I've heard that you had something going on with your wrist.
Yes, my right wrist.
Okay.
I got into an accident and it's just been killing me ever since. So I came here today for you to check it out.
Okay, so when did this happen?
2 weeks ago.
2 weeks.
Mm-hmm.
Have you been taking any medication for it, or?
No, I just have a splint at home
Okay.
that I've been using. Can't tell if it's doing anything though.
Okay. Do you feel it's improving, getting worse, or just pretty much the same?
It's kind of just the same. Mm-hmm.
Okay. Have you noticed any impact on your daily activities? Like, does it bother you when you do regular things like brushing your teeth? Or,
Yes, everything. I am a righty, so.
Okay. That is tough.
Mm-hmm. Interferes with everything.
Yeah. Okay. Can you point to me kind of like the location where it hurts?
It's like more like on the outside.
Okay.
Yeah, of course it is on the inside, but I definitely feel like more muscle strain on the outside of my wrist.
Okay. Okay, I'm just going to ask you a few questions to update your medical history in the system.
Okay.
Do you ever, or have you ever smoked?
Mm-mm.
Do you use any recreational drugs?
Nope.
Okay. Do you exercise?
Yes.
How have you been dealing with your wrist? Did you have to stop exercising these past 2 weeks?
All I've been doing is walking on the treadmill.
Okay.
Yeah, that seems to be the only exercise I can do without my wrist.
Okay. Do you have any medical history of any chronic illnesses, diabetes, any high blood pressure?
Yes, diabetes, and my grandmother had a stroke in the past.
Okay. Is there any chance that you could be pregnant currently?
No, I don't think so.
Okay. Okay. Okay, so I'm going to start like taking a look at the mobility of your hand. Okay. I'm going to start first palpating right here.
Mm-hmm.
Okay. Does it still hurt right here?
Yes.
How about here?
Yes.
Here?
Mm-hmm.
Here?
Not so much.
Not so much. Okay.
It is a shooting pain though.
Okay, where does it shoot towards? Like towards the fingers, towards your...
Towards me.
Okay. Okay, I'm going to be moving your fingers. I just want to make sure there's no pain on the fingers themselves. Does this hurt?
No.
About this? This?
No.
This? Here?
I feel a little strain.
Where do you feel the strain? Do you feel it? Okay. This one, does that hurt?
I feel that strain.
Okay.
Mm-hmm.
But here?
No.
Here? Okay. Does that feel like tension on the
that I notice it's just these two
Okay.
fingers.
Does that hurt at all?
No.
How about this? Okay. Does that hurt?
That's fine.
Okay.
Nothing's wrong.
Here.
All good.
Here.
No.
Okay. Just gonna flip the hand. Just gonna be palpating. Does this hurt at all?
Yes.
Here.
Mm-hmm.
Here.
Mm-hmm.
Here.
No.
Here.
Yes.
Here.
Mm-hmm.
Here.
No.
Okay. Can I have you make a fist? Through your hand. Okay, does that hurt?
Mm-hmm.
Where does it hurt?
Like on the outsides again.
Okay. You can go ahead and relax. Now go ahead and extend the hand as much as you can. Also hurting over here. Okay.
Yes.
Does this hurt?
Mm-hmm.
This is
Yes.
here.
It's not as bad as...
No. But here.
No, not right there.
Oh. Okay. I'm gonna have you do a few movements. I wanna see the range of movement on your hand. Okay, I'm gonna have you do a few movements. I'm gonna be measuring the range of motion on your hand. You go ahead and try to bend your hand at the wrist. Okay, go ahead and put it back to neutral. Okay, we've got a 43 degree. Now we're gonna do the same thing, but towards the other side. Towards, so you can actually go ahead and flip it. It might be easier. You flip the hand, and then you go upwards.
I could barely.
That's as far as it
Yeah.
goes? Okay. Okay. Okay, it's only 20. So these should be closer to 90. Both of them should bend almost at a 90-degree angle, so it's pretty
I cannot do that.
painful. Does it hurt when you try to do that, or does it just feel very tight?
It hurts.
It hurts.
Mm-hmm.
Okay. Okay, now I'm gonna have you, like, you're gonna place your hand just straight and you're gonna try to twist. Okay.
That's about it.
That's about it. Okay. It's pretty small. But about 3 degrees. And let's do the other side. So you're gonna try to bend it towards that side. Okay, that's a lot better. Okay, that's 18. Okay, I'm gonna ask you to give me the other hand. I'm just gonna be comparing. Okay. First, we're gonna bend the wrist upwards. There. I'm actually gonna lift it up. Okay. Okay. Perfect. Yep, that is 80 degrees. Now we're going to do, you can flip it over, go ahead and bend it. Okay. Okay, good again. It's an 85 degree. Okay, now we're gonna do the same thing where you twist it to one side and then the other. Okay. 32. And to the other side. Okay, that one's even better than 40. Okay, very good. I'm going to be doing a series of sensations tests. I want to make sure that there's no nerve damage on your hand. Okay, I'm going to start touching your hands with a few different objects, a few different sensations. I'm going to have you close your eyes. Okay, so this is going to feel sharp and this is going to feel dull.
Dull. Sharp. Sharp. Dull. I think dull. Sharp. 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 Dull. 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 Sharp. 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 Dull. 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 Sharp.
Okay, I'm going to have you flip your hand palm up.
Dull. Dull. Sharp.
Okay.
Sharp. Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp.
Okay, so there's definitely a little bit of sensitivity on your wrist area.
That was kind of hard.
Okay, so we're going to try one more thing. Go ahead and close your eyes. I'm going to be touching you with two different objects. It's going to be either this cold object or warm. Did you feel the difference there?
Can you do it maybe a little higher?
I'm going to do it on the other hand just so that make sure we got it right. So that's cold. Okay. This is warm, okay?
Warm. Warm. Cool. Warm. Cool. 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 Warm. Cool.
Okay, I'm going to be sliding it alongside the skin. Just let me know, does that feel same temperature? Where does it change?
I feel it cool by my elbow and the tip of my fingers, but I kind of lose it around my wrist area.
Okay.
And palm.
Got it. And just do that one more time. Same thing? Yeah.
Same thing.
Okay. Okay, I'm going to be slightly touching your hand with 1 or 2 pressure points. I'm not applying too much pressure. I don't want to cause any pain.
Okay.
Okay.
Can you do it again? 1, 2, 1, 1, 2, 1, 1, 2, 1, 1, 2, 1, 2, 2.
Go ahead and flip your hand over. Okay.
2, 1, 1, 1, 1, 1. Two.
Okay. Okay, now I'm going to be testing your perception of vibration.
Okay.
It's going to be placing this. Let me know if you can feel the vibration.
Kind of.
Kind of. Do you feel it here? Yeah. Is that better?
I feel it in my fingers more than where you're putting it.
Okay. Let's try right here.
A little more.
Yeah.
Yes.
Yeah.
There.
Gonna have you turn it over. Okay. Do you feel that?
Not too much.
About the side?
A little.
More?
No.
No. Okay. Right here?
A little.
Right here? Yeah. Okay. Okay, so there's definitely a little bit of loss of sensitivity on your hand.
Yeah.
I'm gonna have you do a few exercises for me just to measure how the mobility and the strength has been affected. Can I give you this? Can you go ahead and squeeze it as hard as you can?
No.
Okay.
That's about it.
Okay. Okay, we're going to be using some of this clay. It's pretty soft. There are a few different textures. Some are harder than others, but this one's pretty soft. I'm going to have you hold it. You can go ahead and try to squeeze it as much as you can. Okay.
Sticky.
Yeah, it's pretty sticky. Okay, I'm just going to wrinkle that. Okay. Okay. Now I'm going to place this on your hand, and you're going to try to lift the hand from the wrist, just bending at the wrist. Just putting a tiny bit of weight on it.
That's it.
Okay. Okay, now we're gonna go ahead and turn it over. You're gonna hold it right there. I'm going to be placing this. Just try to hold the wrist. Is that hard?
Mm-hmm.
Is that hard to do? Okay. Okay, so this is just a ring. You're going to be placing it on your hand and trying to squeeze. Let's see if... Okay. Let's place it right here. Does it hurt if you squeeze with your fingers?
Not as much. It's more when it's in the middle.
Okay.
It's harder.
Okay. Gonna be placing this just in these 4 fingers. Okay. Can you try to extend? Nope. Okay.
Should have came to you earlier.
Yeah.
Didn't realize how bad it was.
Okay, so we're definitely gonna have to do some exercises just to kind of stretch it out. It is not fractured, so it shouldn't be hurting this much. I think it's just been 2 weeks of you not using it. It's kind of tense and needs a little bit of stretching and for you to be able to start moving it again. Okay. I'm gonna be stretching the fingers out. Does that hurt? Okay, I want to do one more exercise with you right now. I'll give you this notepad and I'm gonna have you just try to write something.
Okay, what should I write?
Your name, you can. Yeah, sometimes the braces, they can just, it's hard to balance the allowing it to move enough for it to not lose mobility, and then also supporting it enough.
Cursive is a little easier.
Okay, perfect. Okay, we're gonna do something right now just to help you regain some of that mobility. Okay. Again, we're going to be using the clay. And I'm actually going to be removing this mat. Okay. So first we're going to do 5 times. You're going to try to squeeze and extend. Squeeze and extend. Okay. I know it's going to hurt at first, but it's going to get a little bit easier as you go. Now you're going to try to roll it into a ball. You can place it on the desk. Okay. That's very good. Now you're going to try to shape it into a ring similar to this. So you can roll it out. Okay, now go ahead and pick it up. You can use both hands. Okay, now go ahead and try to place it on the hand. Okay.
Cute.
Little bracelet.
Mm-hmm.
Okay. So now I'm gonna have you're gonna grab the clay. So right now it's in a strip. You're gonna press and release. Press and release. Okay? Roll it back for you.
Oh.
Okay.
Did you hear my wrist crack?
Yeah. Okay. Okay, very good. Okay. So now what you're going to do is you're going to grab and pull just enough for it to probably approximately like this, just so that it doesn't break.
Okay.
You can join it again and then pull one more time. Use both hands. Okay. We're going to do that 5 times. Okay, very good.
One more.
Okay. Okay. I'll be putting this away. Okay, I do think that your mobility is getting a tiny bit better. So I'm going to give you this one more time and I'm going to ask you to squeeze it in your hand.
Okay.
Let's see how you're doing. Okay. It's definitely a little bit more mobility. I can even see the muscle tensing. Okay. Does that hurt? It's uncomfortable?
It is, but it was harder a little bit ago.
Okay. We'll do the same thing with this one. Okay. Okay, now I'm gonna just place it here and try to raise the arm from the table and try to just keep it straight. Okay. Now go ahead and flip it over. I'm gonna place it right here. I'm actually gonna place this one so it doesn't roll away. Okay, so that's a lot better. So I'm going to give you these to take with you. The putty, the ring, and this little egg. And I want you to do these exercises at least 2 times a day. So just spend 10 minutes doing that in the morning, 10 minutes at night, and you're gonna notice a huge improvement, okay? I'll give you a list of the exercises that we did just so that you can remember them.
Sure.
And I can see you back in 2 weeks.
Okay.
And see how it's developing. I think in 2 weeks you're going to be almost back to normal.
Okay,
but we'll see if there's something else that you need done.
Right.
Okay?
Thank you, Ivy.
Do you have any other questions, concerns?
No, you just said 10 minutes at night, 10 minutes in the morning.
Yes.
Yes?
Yep.
Okay. Yeah,
Okay.
I'll do that.